Here's a Candida infection in immunodeficiency USMLE style question for you. A 22-year-old man presents with a history of recurrent oral and esophageal infections. He complains of painful swallowing and a white, patchy coating on his tongue and the back of his throat. He has also experienced several episodes of severe cutaneous and systemic fungal infections. The patient was diagnosed with severe combined immunodeficiency in childhood and has had a history of recurrent infections, including viral and fungal infections. Physical examination reveals white plaques in the oropharynx, which scrape off to reveal erythematous mucosa. Which of the following is the most likely cause of his recurrent Candida infections? A. Impaired neutrophil chemotaxis. B. Defective T-cell mediated immunity. C. Deficiency of complement C5. D. Decreased serum immunoglobulin levels. E. Impaired production of interferon gamma, IFN glying. Answer and explanation. The correct answer is B. Defective T-cell mediated immunity. Severe combined immunodeficiency involves defects in T-cell and often B-cell function, leading to impaired cellular immunity. Candida infections, especially mucosal infections like oral and esophageal candidiasis, are common in patients with T-cell deficiency, as T-cells play a critical role in controlling Candida through both direct cytotoxic effects and through cytokine production, e.g., interferon gamma, IFN glying, that enhances macrophage and neutrophil responses. Patients with SCID often present with recurrent fungal infections, including Candida species, because their immune system cannot effectively respond to opportunistic pathogens. Neutrophil chemotaxis, option A, is important for defense against bacterial infections, and impaired neutrophil function would lead to bacterial, not fungal, infections. Complement C5 deficiency, option C, is associated with susceptibility to Neisseria species infections, not fungal infections like Candida. Decreased serum immunoglobulin levels, option D, would predispose to bacterial and viral infections, but T-cell function is more critical for fungal defense. Impaired production of IFN gang, option E, is specifically related to defects in T-cell function and would also lead to Candida infections as described in SCID. Key takeaway: Candida infections are common in patients with T-cell mediated immune deficiencies, like SCID, due to the lack of effective immune response to fungal pathogens.